We talked about an implant earlier. I'm a little nervous about it around recovery. I've heard it's, kind of a multi-month process. What's involved from here?
Yeah, that's a good question. So there's a process involved when we talk about who's a candidate for implants. We can replace one single tooth, or we can replace an entire arch of teeth with implants. We go through a thorough medical history evaluation to make sure there are no systemic problems that would contraindicate implant placement or surgery. After that, we take a 3D cone beam x-ray of the entire mouth. It shows us all the anatomical landmarks and limitations that might be involved with placing an implant. It'll let us know if you have any pathology. It'll let us know if you have any disease. It'll let us know if you need extra bone. All of our scans are read by a board-certified radiologist. The good thing about the scan is we can take that and then place the implant digitally before we ever touch you. So on the computer, we'll choose the size of implant that will fit your mouth and your bone. We'll show you on the computer screen how that implant fits. After we've made that determination, we can have a surgical guide made that fits your teeth. Once it goes in the mouth, we know exactly where to place that implant.
Now, how do you avoid I've heard of some nerves and sinus lifts when I looked it up. Do you encounter those, or how are you, how do we do that part?
So every patient's different. All the anatomical landmarks show up on the 3D x-ray. So anything we have to avoid, any nerves that are in the way, any bone grafts that are needed, we'll know by looking at the 3D x-ray. We can avoid complications by avoiding nerves. We can add bone where it's needed. So we have a plan in place before we do anything. We know exactly what to do.
What's the recovery time like after a single implant?
After an implant's placed, we'll have the patient on ibuprofen, Advil or Motrin, some sort of anti-inflammatory for discomfort. Usually nothing more than that's needed. We have a regimen involved that when we do implant surgeries, we have the patient on antibiotics and steroids that cut down on post-op complications and cut down on post-op pain.
Dentures versus implants.
Every denture is different. Sometimes they don't fit that well. Sometimes they need glue to stay in. Sometimes patients are gaggers and can't tolerate a denture well. Sometimes through the best efforts, dentures just won't stay in. So with implants, we can keep dentures fixed to the jawbone. We can keep them in without moving. We keep them in without glue. And we can even cut them out so that we have a horseshoe shape so the patient isn't gagging with the denture in the mouth. There are different types of implant dentures. Some are removable. They come in and out of the mouth. And those are great because they're easy to clean. But some are fixed. And these fixed implant dentures stay in the mouth permanently. The only time they come out is when they come here for cleanings. And it's the closest thing dentistry can offer to getting your teeth back, to eating whatever you like.
How do you make the decision between, deciding when to do a couple of implants versus when to do, I think it's a double arch?
That really comes through with the conversation with the patient and what their needs and what their expectations are. So we decide together what will work best for each patient, what they're looking for, what their frustrations are, and what their journey's been like with trying to keep their teeth healthy. If patients are working really hard at keeping their teeth, but it's just not working for them, we now know that genetics plays a huge role in that.